5 studies that will be presented at the upcoming 2016 ASCO Annual Meeting were highlighted during a recent ASCO presscast. The research included long-term data for pembrolizumab in melanoma, results on the significance of tumor location in colon cancer, data evaluating precision medicine in early-stage research, a study showing the continued significance of stem cell transplants in myeloma, and an analysis of the impact on family caregivers when patients receive early palliative care. Welcome to Enclave News Network. I'm Gina Columbus. 40% of the patients with advanced melanoma who started taking pembrolizumab during the clinical trial that led to its initial approval were still alive after 3 years, according to research being presented at ASCO this year. The long-term results from the KEYNOTE-1 study showed that 15% of the patients who received the checkpoint immunotherapy drug in the pivotal trial experienced complete remissions according to the immune-related criteria. Of these patients, nearly 90% are still in remission. Before checkpoint inhibitors were introduced in 2011, patients with advanced melanoma had a median overall survival of less than 1 year. The median overall survival for all patients in the KEYNOTE-1 study was 24.4 months. The study included 655 patients with advanced melanoma. 75% had previously received other treatments. Pembrolizumab, sold under the brand name Keytruda, is a PD-1 checkpoint inhibitor. The FDA granted the drug an accelerated approval in melanoma in September 2014 based on response rates among a cohort of patients in the KEYNOTE-1 study. A subsequent study indicated that pembrolizumab significantly improved survival compared with ipilimumab. Commenting on the latest pembrolizumab results, lead study author Dr. Caroline Robert, head of the dermatology unit at the Institut Gustave Roussy in Paris, France, said, "Advanced melanoma is still a very challenging cancer, which is why it is so remarkable that such a large proportion of patients see a long-term survival benefit from this therapy. The results of this study further demonstrate the potential for long-term benefit with pembrolizumab." A retrospective analysis of data from the Phase 3 80405 trial found that the location of the primary tumor within the colon predicts survival and may help with treatment selection for patients with metastatic colorectal cancer. In the primary 80450 analysis, there was no overall survival or progression-free survival difference when bevacizumab or cetuximab were added to first-line FOLFOX or FOLFIRI in patients with KRAS wild-type mCRC. However, the data from the retrospective analysis showed that patients whose primary tumors originated on the left side of the colon survived significantly longer than those whose tumors originated on the right side. The median OS was 33.3 months for patients with left-sided tumors versus 19.4 months for patients with right-sided tumors. Among patients receiving cetuximab, the median OS was 36 months versus 16.7 months, respectively. For those receiving bevacizumab, the median OS was 31.4 months and 24.2 months for patients with left and right-sided tumors, respectively. The retrospective analysis also suggested that the relative effectiveness of cetuximab and bevacizumab may differ depending on the primary tumor location. Summarizing the results, lead study author Dr. Alan P. Vinook, professor of medicine at the University of California, San Francisco, said, "While previous studies had suggested that tumor location may impact clinical colorectal cancer outcomes, the effect we observed in this analysis appears to be far greater than we expected. These findings will likely change the way we approach colorectal cancer treatment and research, even as we seek to more deeply understand the biology driving the difference in outcomes between right and left-sided cancers." Outcomes were significantly better in Phase 1 clinical trials that utilized a biomarker-based treatment selection strategy compared with non-personalized treatment selection, according to a meta-analysis of more than 13,000 patients enrolled across various Phase 1 clinical trials. In the study, there was a tumor shrinkage rate of 30.6% in the biomarker-driven arm, compared with just 4.9% in the non-personalized arm. The median progression-free survival in the biomarker arm was 5.7 months, compared with 3 months without biomarker selection. Additionally, the large study showed that not all biomarkers were the same, as patients matched to therapy based on DNA markers showed a higher tumor shrinkage rate versus protein biomarkers. In the DNA arm, 42% of tumors shrank versus 22.4% for those with protein-based biomarkers. Commenting on the study, ASCO spokesperson Dr. Don Dizon said, "This study reinforces that the more we personalize treatment to the patient and the tumor, the better the outcomes, even in the earliest phases of research." Early findings show that patients with multiple myeloma who received an autologous stem cell transplant may survive longer without disease progression than those who received only chemotherapy with novel agents. In a randomized phase 3 study, 1,266 patients under 65 with newly diagnosed multiple myeloma received either bortezomib, melphalan, prednisone, or high-dose melphalan followed by single ASCT following induction therapy with bortezomib, cyclophosphamide, and dexamethasone. After a median follow-up of 2 years, median progression-free survival was not yet reached, and preliminary data showed that patients who received stem cell transplants progressed slower than those who received VMP therapy without transplant. Among patients who had not yet experienced disease progression, those in the ASCT arm had a 24% lower risk of progressing at any future time point compared to those not receiving transplant. Discussing the trial, lead study author Dr. Michele Cavo, head of the Seragnoli Institute of Hematology at the University of Bologna, said, "Our findings show that autologous stem cell transplant should remain the preferred treatment for patients with multiple myeloma age 65 and under. While transplant-free treatment with novel agents remains an intriguing prospect, the reality is that stem cell transplant remains a powerful and proven approach, and with novel agents playing a supporting role, it is more effective than ever." It is understood that patients who receive early palliative care along with standard oncology care experience better quality of life and outcomes. According to a study presented on the ASCO Presscast, this benefit of early palliative care extends to family caregivers. In the study, 350 patients and 275 family caregivers were analyzed from 2011 to 2015. Patients were newly diagnosed with incurable lung or gastrointestinal cancers. The intervention required monthly palliative care visits, though family caregivers were not required to attend. At the 12-week analysis, family caregivers of patients receiving integrated palliative care and usual care reported higher vitality and social functioning and lower depression symptoms. At 24 weeks, the group still had lower depression symptoms compared with the family caregivers of patients receiving usual oncology care alone, but there was no difference in vitality or social functioning. Commenting on the study, ASCO President Dr. Julie M. Vose said, "Caregivers provide critical support for patients with cancer, but it can take a heavy toll. This study shows that early palliative care, although designed for and directed at patients, can also help ease the burden on their caregivers." Full results from each of these 5 studies will be presented at the 2016 ASCO Annual Meeting, which will be held in Chicago from June 3rd through 7th. That's all for today. Thank you for watching Enclave News Network. I'm Gina Columbus.